The last century has given us extraordinary breakthroughs in medical science. We now have the knowledge to make a difference in everyone's lives, and yet we're not delivering on it. Healthcare systems are failing everywhere, from the richest to the poorest parts of the world, and they're failing to deliver on knowledge that already exists. The result is suffering on a massive scale, and it's all avoidable. I'm Atul Gawande, and 5 years ago, I founded Ariadne Labs because we have ways we can do better, a lot better. Everyone at some point in their lives ends up needing surgery, but 7 million people worldwide are left dead or disabled because of complications from surgery that we already know how to avoid. Childbirth is still one of the biggest killers in the world for young women and babies, and 99% of those deaths are avoidable with existing knowledge. What all of this indicates is that lack of execution is now our biggest challenge for health. The reason is complexity. The amount of knowledge and capability required to consistently deliver on the quality of care that is possible has completely exceeded what any individual can pull off by themselves. So we need help. We believe the answer is health system innovation. We can simplify the complexity. We are showing that it's possible to save lives and reduce suffering through simple, scalable solutions that help clinicians deliver better care at the most critical moments in people's lives everywhere. We've discovered that giving people simple tools, like just a checklist, can make it dramatically easier for clinicians to deliver the best possible care. And it's a science. This is a new kind of science, the science of health systems innovation. It starts with defining where the failures occur, research on why does complexity overwhelm the team, where can it be solved, and we design solutions, prototypes, easier ways of getting the job done. 5 years ago, we founded Ariadne Labs to provide proof of concept. That is, we had proven that a simple surgical checklist could be used in ways that cut deaths 50% in operating rooms. We had shown that to be true in 8 hospitals around the world with 8,000 patients. We wanted to prove that this could get reductions in death at large scale in populations around the world. And now, 5 years on, we've shown it's true. Our vision is that we can have healthcare systems that deliver the right care the right way, every time, everywhere. In surgery, we've run projects with the entire state of South Carolina, with the countries of Scotland and New Zealand, and we've demonstrated large reductions in death at population level.
As an operating room nurse, I was on my hospital's implementation team and saw firsthand how impactful this powerful tool was for our patients, our surgical teams, and our operating room culture. In South Carolina, our hospitals that implemented the Safe Surgery Checklist saw a 22% reduction in post-operative mortality. We are truly saving lives.
In childbirth, we worked with the World Health Organization to develop a safe childbirth checklist of the most critical practices required for the 7 big killers for moms and babies. And then in India, we deployed it with birth attendant coaching. That work demonstrated marked improvements in the likelihood that they use those practices on a consistent and reliable basis.
अगर तेज खून चल रहा है, पेट में तुम्हारे दर्द हो रहा है, तो इनको बता देना, फिर ये हमको बता देंगे आके, ठीक है माता जी, इनका ध्यान रखना इनका। बेटर बर्थ प्रोग्राम जब नहीं था, तो हमको पता नहीं होता था कि ऑक्सीटोसिन या बीपी से या किस चीज़ से हमें मरीज़ को क्या प्रॉब्लम हो सकती है। जैसे ब्लीडिंग होने लगी, हमें नहीं पता कि इसको किस कारण उस ब्लीडिंग हो रही है। चेकलिस्ट के आने से हम हर चीज़ का मतलब समझ में आ गया है।
In the high-income world, one of our biggest failures is to deliver quality care at the end of life. The reason for that failure is we're not having the key conversations that allow people to voice what their priorities are for their care besides just the quantity of life. We also care about our quality of life, and we don't talk about it. Training clinicians in using a serious illness conversation guide allows them to have more, earlier, and better conversations. Conversations that focus on identifying what people's priorities are for the life they want to lead all the way to the end. We've deployed this approach in large-scale systems, reaching everyone from primary care patients to cancer patients. The results are showing marked reductions in suffering.
What you hear is a common theme of, I wish I had this last week for a patient, or I know exactly the patient, I'm going to use this for their next office visit. So it's really exciting to see that invigoration in colleagues, and it gets back to the heart of medicine, to be able to truly sit down with a patient in a family unit and really engage in the fidelity and covenant of trust that is so special and unique to medicine.
Our job now is to take our discoveries to large scale. That's a science in and of itself. We need to bring the science of systems innovation to new critical areas in healthcare. On any given day, 11,000 women will deliver a baby in the United States. 1/3 will end up having a C-section, surgery, to deliver that baby, and we know that's too many. Can we do better? Absolutely. Another critical area is primary healthcare. We need primary healthcare systems that work in order to provide prevention from childhood, management of acute illnesses along the way, and then management of chronic illnesses like high blood pressure. When it's done right, you add years to people's lives. We're building an entire community of scientists here in Boston and around the world, a community of systems innovators who are transforming care everywhere. Our vision is a system that can deliver the right care the right way every time, for everyone. There's been a massive underinvestment in this field. We have focused on breakthrough innovations without a matching effort in follow-through innovation. But we're now showing that systems science and innovation is the biggest opportunity to advance human health and well-being. That is our opportunity, and we're following it here at Ariadne Labs.